Have you ever pondered what happens inside your body when your blood sugar levels skyrocket? Well, let's delve into a journey inside the human body to unravel the mystery of hyperglycemia. Hyperglycemia, quite simply put, is a medical condition characterized by high blood sugar levels. It's akin to having an excess of fuel in your car's engine that it can't burn off effectively. Now, this might sound inconsequential, but it's far from it. This surplus of sugar in your bloodstream is not a sweet deal. In fact, it's a common issue among individuals diagnosed with diabetes, both type 1 and type 2. But what exactly causes this surge in blood sugar levels? The answer lies in a hormone produced by your pancreas known as insulin. Picture insulin as the key that unlocks your body's cells, allowing sugar to enter and be used as energy. However, in some instances, there is either not enough insulin in the body or the body is unable to use insulin as effectively as it should. This causes the sugar to build up in your bloodstream instead of being absorbed by the cells, resulting in hyperglycemia. Now, you might be wondering, what's the big deal about having a little extra sugar in the blood? Well, it's not a little problem. If left unchecked, hyperglycemia can lead to a cascade of health issues, damaging everything from your nerves to your blood vessels, tissues, and vital organs. In some severe cases, prolonged high blood sugar can lead to life-threatening complications, such as diabetes-related ketoacidosis. This is when your body, unable to use the sugar in your blood, starts breaking down fat for energy instead, which produces toxic acids known as ketones. So you see, hyperglycemia is not just a concern for those with diabetes, but for everyone. It's crucial to understand what it is, how it happens, and most importantly, how it can be managed. Because knowledge, as they say, is the most potent prescription. Hyperglycemia, if left untreated, can cause severe health issues, making its understanding crucial for everyone, not just those diagnosed. Now, you might wonder what triggers this surge in blood sugar levels. A simple question with a multi-layered answer. Let's delve into it. At the heart of hyperglycemia is an imbalance, where the body either has too little insulin or can't use the insulin it has effectively. Insulin, the hormone that regulates blood sugar levels, is like a key that unlocks the cells to allow glucose in. When there's not enough insulin, or when the cells resist its effect, known as insulin resistance, the glucose is left stranded in the bloodstream. This results in high blood sugar levels, the defining feature of hyperglycemia. But what causes this imbalance? Well, several factors can play a part. Hormonal conditions, for instance, can interfere with insulin production or function. Conditions like Cushing's syndrome, which causes the body to produce too much cortisol, a hormone that increases blood sugar, can lead to hyperglycemia. Genetic conditions can also be a culprit. Certain genetic mutations can affect the body's ability to produce or respond to insulin. For instance, maturity-onset diabetes of the young, or MODY, is a form of diabetes that results from specific gene mutations and can lead to hyperglycemia. Damage to the pancreas, the organ that produces insulin, can also result in hyperglycemia. Conditions like pancreatitis, pancreatic cancer, or cystic fibrosis can impair the pancreas's ability to produce insulin, leading to high blood sugar levels. And it's not just physical conditions that can cause hyperglycemia. Emotional stress, believe it or not, can temporarily spike blood sugar levels. Stress hormones such as cortisol and adrenaline can cause the liver to release more glucose into the bloodstream, leading to hyperglycemia. So, as you can see, the causes of hyperglycemia are diverse, ranging from hormonal and genetic conditions to stress and pancreatic damage. Each cause paints a piece of the hyperglycemia picture, adding complexity to this health condition. Understanding the causes of hyperglycemia is the first step towards its management and prevention. And with that understanding, we can begin to unravel the strategies to tackle this condition, which we'll explore in the upcoming scenes. So how would you know if your blood sugar levels are running high? Well, let's start by discussing some of the common symptoms of hyperglycemia. Firstly, there's frequent urination. When sugar levels in the blood are high, the body tries to get rid of the extra sugar by filtering it out of the blood and into the urine. This process can result in more trips to the bathroom than usual. Next, you might notice an increased thirst. This is the body's way of trying to replenish the fluids lost through excessive urination. You might find yourself reaching for a glass of water more often than usual, even if you haven't been particularly active. Fatigue is another common symptom. When there's too much sugar in your blood, your cells can't get the energy they need, which can leave you feeling tired and run down. But hyperglycemia isn't just about these immediate symptoms. If left unchecked, high blood sugar levels can lead to a variety of complications. For instance, prolonged hyperglycemia can cause nerve damage, a condition known as neuropathy. This can result in numbness, tingling, or even pain in your hands and feet. Eye diseases such as retinopathy are another potential complication. High blood sugar levels can damage the blood vessels in the retina, the part of the eye that's sensitive to light. This can lead to blurry vision or even blindness. Lastly, we have kidney damage. Over time, the kidneys can become overwhelmed by the excess sugar and start to lose their ability to filter waste from the blood effectively. This can lead to kidney disease or even kidney failure. Being aware of these symptoms and complications can help in early detection and treatment, reducing the risk of severe health problems. So, stay vigilant and listen to your body. It might just be trying to tell you something important about your blood sugar levels. If symptoms hint at hyperglycemia, how can one confirm it? And what steps can one take to manage it? Let's delve into that. The primary method of diagnosing hyperglycemia as well as diabetes is through blood tests. This might involve a fasting glucose test, a random glucose test, or an oral glucose tolerance test. In each of these, a healthcare professional measures the amount of glucose in the blood. The glucose level at which hyperglycemia is diagnosed can vary depending on the individual and whether they have diabetes. Once hyperglycemia is confirmed, it's time to consider treatment options. The aim is to lower and regulate blood sugar levels, and the approach is often multifaceted. Firstly, insulin injections may be needed. Insulin is the hormone that helps regulate blood sugar levels. When there's too little insulin or when the body can't use insulin properly, blood sugar levels can rise. Insulin injections can help keep these levels in check. In addition to insulin, oral medications might be prescribed. These medicines work in different ways. Some boost the body's insulin production, some improve the effectiveness of insulin in the body, and others slow down the absorption of carbohydrates, which can help prevent blood sugar spikes. But treatment isn't just about medication. Dietary changes play a crucial role. This might involve reducing the intake of carbohydrates, which are the body's main source of glucose. Consuming a balanced diet with plenty of fruits, vegetables, lean proteins and whole grains can help manage blood sugar levels. Exercise too is a key component of treatment. Regular physical activity can help lower blood sugar levels and boost the body's sensitivity to insulin, helping it work more efficiently. This doesn't mean you need to run marathons. Even moderate activity like a brisk walk can make a difference. Remember, everyone is unique, and what works best will depend on the individual's overall health, lifestyle, and the severity of their hyperglycemia. Proper diagnosis and treatment are pivotal in managing hyperglycemia and preventing its deadly complications. Scene script. Can one prevent high blood sugar levels? And what does the future look like for someone with hyperglycemia? Let's delve into these questions. Preventing high blood sugar levels isn't a matter of chance, but one of understanding and action. To begin, it's crucial to comprehend the causes of hyperglycemia. Often it's a result of insulin resistance, certain hormonal or genetic conditions, or damage to the pancreas. Emotional and physical stress can also temporarily spike blood sugar levels. Once you've grasped the causes, the next line of defense is medication. For those already diagnosed with hyperglycemia, medications are a key tool in managing high blood sugar levels. Insulin injections and oral medications play a pivotal role in maintaining a balanced blood sugar level, but they are not a standalone solution. Dietary choices can have a significant impact on blood sugar levels. Consuming a balanced diet, rich in fiber and low in processed sugars, can help regulate these levels. Foods that are high in carbohydrates can cause a spike in blood sugar, so it's important to monitor carbohydrate intake. Exercise, too, is a powerful ally in the fight against hyperglycemia. Regular physical activity helps the body use insulin more efficiently and aids in maintaining a healthy weight, both of which are crucial in managing blood sugar levels. But what about the future? What does the prognosis look like for someone with hyperglycemia? Well, the answer largely depends on how well it's managed. Uncontrolled hyperglycemia can lead to severe complications like nerve damage, eye disease, and kidney damage. However, with diligent management through medication, diet, and exercise, the prognosis can be quite positive. It's important to remember that managing hyperglycemia is a continual process, not a one-time fix. Regular monitoring of blood sugar levels and consistent adherence to treatment plans are crucial. With the right knowledge and proactive measures, it's entirely possible to manage hyperglycemia effectively and lead a healthy life. The key lies in understanding, adapting, and persisting in the journey to maintain balanced blood sugar levels.